If you're an athlete, you've likely heard about people who've torn their plantar plate. You may have wondered, what is this foot structure? The plantar plate is an important ligament in the ball of the foot that keeps your joints stable, protects the bones from too much pressure, and stops your toes from spreading out or bending too far. When this ligament gets overstressed or strained, as you go up over the ball of the foot, it can tear. While these injuries are common in sports, they can also occur from too much force, such as a fall or other factors. Today I'll be talking about what else causes plantar plate tears, its symptoms, treatment, and prevention. But before I do, I'd like to introduce myself. I'm Dr. Rion Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. If you find this information helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification every time I release a new video. Let's start by learning what causes a plantar plate tear. While a tear can happen to any joint in the ball of the foot, it most often affects the second toe. That's because it's often the longest toe in the foot and longest joint in the foot, and takes on the most force, making it more likely to get injured. Earlier I mentioned that falls and participation in sports can cause a plantar plate tear. Most often high-impact sports like running, jumping, dancing, and gymnastics are to blame. Other factors that can increase your risk are flat feet, low arches, and overpronation. Having a longer second toe, also known as Morton's toe, because when the second toe is longer, more force is applied to that area during sports activity than to your great toe joint. Having bunions or hammer toes can also add stress to the bottom of the second toe joint. The tight calf muscle can cause overpronation and more force on the ball of the foot. Wearing unsupportive shoes on and off the field. How do you know you've torn your plantar plate? Well, you won't know for sure until you've seen a podiatrist. You're likely to experience one of the following symptoms: pain and swelling in the ball of your foot, especially around the affected toe joint. More pain when you're on your feet barefoot or wearing flexible shoes on hard surfaces. The toe is sticking up with swelling or redness on the top of the foot. Toes that start to separate and look like a victory sign, with the second toe moving toward the great toe. This is called the Churchill sign. Feeling like you're walking on the bone of your foot. There are several things you can do at home to begin treating a suspected plantar plate tear. Avoid any activities that cause your foot pain or make it worse. Use the RICE protocol for the first 48 hours. This stands for rest, ice, compression, and elevation. Get that foot off the ground. Avoid walking barefoot. Consider using OOFOS, O-O-F-O-S, or another sandal or slipper with arch support and good shock-absorbing foam. Then ask your doctor about taking anti-inflammatory medications. In the office, we can offer several modalities to help you heal. Plantar flexion taping is this taping to hold the toe down, take the pressure off the joint as you step forward. A walking boot to limit your movement forward. Metatarsal pads to lift up behind the area of stress. We may offer custom orthotics once your inflammation is down and your foot has healed. These are effective for patients with poor foot mechanics to help prevent future tears and other foot problems. For patients with tight calf muscle, it's crucial to use an Achilles splint. This is a stretching splint to be used for 30 minutes a day, sitting at home. It's very easy to use, and we'll put a link in the video above. Finally, if we do suspect a rupture, an ultrasound and an MRI may be ordered to help diagnose this for sure. There's a newer procedure called a brace procedure that's been very successful in replacing the torn plate. This procedure will resolve the pain and return you to your previous sports activities. You can prevent a plantar plate injury by taking the following measures. Avoid wearing high heels, flip-flops, and other flexible shoes. Bend too much in the ball. Instead, wear a supportive athletic shoe with a rocker sole like Hoka, H-O-K-A. We put a video in here to show you how to test your shoes before you buy them. Wear your orthotics consistently. Before participating in sports, warm up with dynamic stretching and regular calf stretches afterwards. I've put some links in the video above. Use an Achilles splint, a stretching splint, to get that calf stretched out. This will really help avoid overpronation of the feet. By taking these simple steps, you can keep your feet healthy and strong and avoid dealing with a painful plantar plate tear.